Assessment of etiology of chest pain is one of the most difficult tasks in practice of cardiology. If details regarding the patient's pain or discomfort are not properly gathered, over-testing is frequently performed. Biomarkers, exercise tests, or even coronary angiography or other equally life-threatening entities might be missed, such as pulmonary embolus or aortic dissection. There is certain characteristic of chest pain. They are quality or precipitating and relieving factors. On the basis of this, we can judge more accurately about the chest pain. The duration of the symptom is important in patient with chest pain. And location or radiation is also important because heart is a visceral organ, so its pain may be radiate in different directions. Now we are going with different etiologies. Angina. Angina is symptom of coronary artery disease. Angina is chest pain that happens when your heart needs more oxygen-rich blood. Angina is not a disease, it's a symptom and warning sign of heart disease. Now go with the quality or precipitating and relieving factor. Pressure, heaviness, tightness, precipitated by exertion or emotional stress, relieved by rest or nitroglycerin. Now go with onset or duration. Duration less than 10 minutes, typically 2 to 5 minutes. Concern for myocardial infarction if it lasts more than 30 minutes. Now for the location or radiation. Mainly it's substernal. Typically radiates to arms and shoulder. Left more commonly than right. Pain may be on jaw or neck. Now pericarditis. Pericarditis is inflammation of the pericardium. Pericardium is the outermost covering of the heart. Quality or precipitating and relieving factors in pericardium, that is sharp, pleuritic, positional, relieved by sitting or leaning forward. Onset or duration is insidious onset, last hours or days, and the location or radiation is substernal, might radiate to left shoulder. Go with other etiology. Aortic dissection. Aortic dissection is a serious condition that occurs when the inner layer of aorta tears, allowing blood flow between the layers of the artery wall. Now go with the quality or precipitating and relieving factors. Hearing, ripping, typically severe at onset. The onset or duration is sudden onset. Location or radiation for the aortic dissection is anterior chest, radiates to the back or interscapular area. Let's go with the other etiology. Pulmonary embolism. Pulmonary embolism is a serious condition that occurs when a blood clot blocks an artery in the lungs. The embolus may be formed anywhere in the body. Now talk with quality or precipitating and relieving factors. Are sharp and pleuritic. The onset or duration is sudden onset. The location or radiation is typically ipsilateral to the involved lungs. Other etiology is costochondritis. Costochondritis is a condition that causes inflammation of the cartilage that connect your ribs to your sternum. A sharp, occasionally or dull pain in your chest, especially when you move or breathe. It can feel like a heart attack. Quality or precipitating and relieving factors. This is dull, occasionally sharp, may be reproduced by local pressure. The onset or duration is insidious onset, might last for days. The location or radiation is external or para-external. Now go with etiology. Gastroesophageal reflux. Gastroesophageal reflux, commonly known as GERD, is a condition in which stomach acid repeatedly flow back up into tube connecting the mouth and stomach. The quality or precipitating and relieving factors is burning, worse in the supine position, relief by antacid. The onset or duration is typically 10 to 60 minutes in duration, often postprandial. The location or radiation is subexternal epigastric. Let's go with other etiology, esophageal spasm. An esophageal spasm is an abnormal contraction of the muscle in the esophagus, the tube that connects your mouth to stomach. Squeezing pain in the chest that feel like heart pain or heartburn. Go with quality or precipitating and relieving factors. Are pressure, tightness. Might improve with nitroglycerin. The onset or duration is sudden onset, duration less than 30 minutes. The location and radiation is subexternal. Go with other etiology, that is psychiatrics. The quality or precipitating and relieving factors is Vagi may simulate angina, often associated with anxiety. The onset or duration is variable duration and onset, might last hours or days. The location or radiation is variable, might be subexternal. These are the characteristics of chest pain according to the different etiology. Let's talk about other categories. Foster and Diamond categorize chest pain into typical angina, atypical angina, and non-cardiac chest pain. They based this classification into on whether the pain was subexternal and pressure-like, was precipitated by exertion or emotional stress, and was relieved by rest or nitroglycerin and lasted less than 30 minutes. The category for the Foster and Diamond typical angina have all three criteria were present, and atypical angina where two criteria, and non-cardiac chest pain have only one criteria fulfilled. This criteria is helping in forming an initial impression of the etiology of the pain and can then direct the clinician to further targeted testing.